Hey, it's Jessica DeMassa with WTF Health, and I am here with Kathleen Elmore. She is the Managing Director of Engageus. And so I understand you're a bit of an expert in the consumer health space. So tell us, what are we doing right and what are we doing wrong?
Great question. So when I look around, there's so many fantastic technologies. There's all kinds of great data analytic companies, but unless we can engage the consumer, all of it's for naught, right? So you can have all the best technologies, but if you build it, they don't always come. And so thinking about how to engage consumers in their health, really there's a lot to be learned from outside of healthcare. People talk about the Googles and the Amazons. I've actually, been in consumerism all my life. I started at companies like Procter & Gamble and General Mills. And I'd like to say that when I was at Betty Crocker, I would have killed for this much data on my consumers. I think we have such an opportunity in health to even do more than we're doing about using these methodologies that have worked to get you to eat Snickers when you're not hungry or buy things you can't afford, to get you to get the colonoscopies, to fill your meds, all those things that are so critical.
How do you do that? Because really, it's much easier to convince this girl to eat a Snickers bar when she's not hungry than it is to go and get a colonoscopy. How do you do that?
Absolutely. So in health, it's personal. I had the luxury when I was at Cheerios of having a a tiny slice of a market. So I had affluent moms with new babies. And so I knew right away there's two things that motivate them. One is, a good first food for their baby, or they might have husbands with bad cholesterol. Those are my two messages. In health, we're at a disadvantage that we have all walks of life, all race, socioeconomic status, education, you name it, and then add to that a whole nother class of data called health status. And so how do you get to those silver bullets? You don't. It becomes super personal. And so having those technologies that allow you to really start those one-on-one, interactions is critical. But then knowing the questions to ask with consumers. So for instance, barriers. Barriers are what gets in the way of taking these health actions. We've found over 250,000 barrier studies that they don't fall along demographic lines. They're very personal. And so if you say, hey, I don't have time to go fill that med, and I say, but it's free, that does nothing for you. I need to be able to say to you what's important to you to overcome that barrier. And we find consistently when we do these barrier-breaking messages, we turn 30% of no's into yeses consistently for colonoscopies, med adherence, well visits, you name it. So it's getting really personal that's going to crack the code.
Okay, so basically, let me just say this back to you, make sure I've got it right.
Yeah.
So you're looking at the data in a different way in the sense of almost like psychographics and things like that as opposed to demographics. So you're not going along like age and race and things like that necessarily. You're looking instead at what is the reason why they're not doing this, or what is the reason they are doing this, or what kinds of things matter to them. Is that right?
Absolutely. We call it, there's a golden rule from the consumer world that there's three types of data: behavioral, demographic, and attitudinal. And there's this golden rule that behavioral data is 5 times more predictive than demographics, which is then 5 times more predictive than attitudes. Basically, what consumers do is so much more powerful than what they say. And we see that over and over again. If I can tell you a fun story from my...
Yes.
Okay, good. So when I used to work in television...
We love fun stories.
Okay, good. We asked men 25 to 54 what was their most watched television channel. Not favorite, most watched. We got back from the surveys, statistically significant, CNN and History Channel. When we took the Nielsen meters, those are set-top boxes that measure actual behavior, out of the homes, turns out what they were watching was ESPN and TNT Wrestling. Why the bias? Well, we figured either they're trying to sound smart, they were trying to possibly save little watch channels, or maybe the time spent on History Channel was so painful it felt like twice the time spent on ESPN and TNT. So what we know is that behavioral data is king, and the great thing about healthcare is we have a ton of it. So to mine it and to use it to drive better health, the opportunities around this.
How do we do that? What are some tips?
Sure. So I always say what's not used enough in healthcare is test and learn, A/B testing, champion challenge, whatever you want to call it.
I've heard that before.
So find those opportunities to start testing, because again, when I was in the consumer world, really a lot of the lessons have been learned. I knew if I tilted a stamp or threw coffee in the envelope, my open rate would go up a little bit. Because health is so fragmented, there's so many things we need them to do across so many different types of people, that all these silver bullets are still in the making. And so this crowd here and all the folks that are key stakeholders, we're lifting that information knowledge every day as we go through our programs. And so I challenge people just every single time, do an A/B test, and what you find out, make it part of your Bible, and then go from there.